Do you think seasons have an impact on diabetes?
Yes, seasons do impact blood sugars. With very hot weather, I mean, obviously, you're going to lose more fluids.
So, do you advise some people with diabetes not to drink that much water? Why so?
In such people where the heart is already overworking or overburdened, prudent to restrict the amount of water.
What do you have to say about fruits?
Restrict, their intake of mangoes to maybe 3 slices or half a mango.
So, if you have diabetes and you're watching this video, you can have mangoes, but consult your doctor once. What are the complications of the monsoon season on people with diabetes?
Avoid eating out. Dengue, of course, is a dreaded illness which we see every monsoon.
So, also suggest some precautions with respect to blood sugar monitoring.
The humidity tends to cause the strips to malfunction.
Hello Delhi people, how are you coping up with this extremely hot weather in Delhi? It's almost touching 50 degrees Celsius. And wahi Mumbai maybe it's very, very humid. Already the monsoon season has started coming in. And in fact, even Bangalore, I've checked with my friends, it's quite humid. And I was really curious to know how seasons impact people with diabetes. And for answering that, in today's episode of Sweet Talk with Vito, we have Dr. Anupama again, who will answer all our questions related to diabetes and how blood sugar levels fluctuate in extreme summer season and the coming monsoon season that's almost going to hit anywhere in July and August. So, hello doctor, how are you?
Hello, Akhil. I'm very well and thank you so much for having me.
So doctor, you already know how hot it is in Delhi, already touched 2-3 times 50 degrees Celsius and usual 45-48 is, even the ACs are failing to, compensate that heat. So how are the patients coming to you and asking their doubts about diabetes and how are their blood sugar levels impacted? So do you think seasons have an impact on diabetes?
Well, that's an interesting question, Akhil. Yes, seasons do impact blood sugars, and typically the blood sugars that tend to go up are mainly because of infractions with diet. But again, I must say that extremes of temperature also make it difficult to control your blood sugars, because when the temperatures are very high and patients are very uncomfortable, then yes, you can have the sugars, become high. But at the same time, in summers where there's vasodilatation, the blood vessels dilate. Often, we find that absorption of insulin, patients who are on insulin, the absorption of insulin is quicker, is more complete, and sometimes that can also lead to lower blood sugar levels.
Okay. So if I talk about the scorching heat, it's absolutely hot outside, right? The moment you move out, it feels like you're burning.
Correct.
So if a person with diabetes moves out in summer, does the blood sugar level fluctuate up and down?
So typically that really depends on A, how well the sugars are controlled to begin with, and B, how well the person who's living with diabetes is taking care of, his diet, his water intake. Do they keep themselves, do they take adequate precautions when moving into the sun in terms of sunscreens, in terms of using an umbrella or using some kind of a shade so that they're not really exposed to direct heat.
So that adds to one of my questions, that do people with diabetes apply sunscreen, and does that also have some impact on their body or anything to do with sugar levels?
So typically, the sunscreen should be and is used by everybody, whether it's diabetics or non-diabetics, so as to prevent the harmful UVB and A rays from harming your skin. That they do not impact your blood sugars directly. But as I said, using a sunscreen is basically to protect your skin. It's not really
associated with blood sugar levels.
Blood sugars.
Okay.
But, to keep well hydrated, to make sure that you're getting adequate fluids, that would really impact your blood sugars, because if you're dehydrated, if your blood is concentrated, you immediately will see the sugars rising.
Right. So my next question is that only. So how this extremely hot weather affects dehydration, and which leads to obviously hyperglycemia?
So with very hot weather, obviously you're going to lose more fluids. So there's insensible loss. You lose fluids from the skin. You lose fluids when you breathe from the lungs. So apart from, the normal, you lose fluid from when you sweat. So obviously your fluid intake has to be higher. So with such extreme heat, you need to increase the amount of fluid intake. So a minimum of 2.5 to 3 liters of fluid, which is roughly translates to 10 to 12 glasses of water in a day, is important to take unless you have been specifically asked to restrict the amount of fluid that you take in a day. And there are diabetics and other kinds of people with other disorders, cardiovascular disorders, etc., or even kidney issues who have been asked to restrict their fluid intake. So in that case, please go with your doctor's advice and restrict your fluid intake to as much as your doctor has asked you to. But every other person living with diabetes who does not have a comorbidity must make sure that they take in at least 2.5 to 3 liters of fluid in a day.
So do you advise some people with diabetes not to drink that much water? Why so? I'm just curious to know.
So there are some people with diabetes who develop, cardiomyopathies, or who develop a heart condition in which the heart does not pump as effectively as a normal person's.
Okay, so that's a complication.
So it is a complication. It may be seen in non-diabetics as well, but it's may be seen in people with diabetes as well. So in such people where the heart is already, overworking or overburdened, it is prudent to restrict the amount of water that you take.
Okay, and also usually in hot weathers, people tend to go out and drink shikanji, ampanna and all. So what do you suggest? Do you suggest your patients to drink all of these sharbats and drinks to keep themselves hydrated, or you ask them absolutely to avoid these drinks, especially with people with diabetes who have had diabetes since 5, 10, 12 years?
You're absolutely right. So with summers, you get a range of beverages, which are very tempting, and obviously they're hydrating and they cool you down, and everybody wants to partake of these beverages. Yes, people who are living with diabetes should avoid having drinks which are very high in sugar content, So we do ask them to not take, sharbats and shikanjis, mango shakes, and all these other drinks which have a large amount of sugar. Also ampanna, which has a very large amount of sugar. But at the same time, we don't want to, restrict their intake of such drinks. And people living with diabetes can enjoy these drinks as well. And I always ask them to have these drinks, make them themselves at home, and use sugar-free. To make ampanna, use sugar-free to make lassi, use sugar-free to make, whatever kind of drink that they enjoy. And there's no reason why they cannot enjoy those drinks as well. The only rider that I would say is that do not use too much of sugar-free, because again, that's not something that we would like to promote. It's not exactly healthy, but at the same time, it can help people living with diabetes to enjoy their favorite beverages. If they use 1 or 2 sugar-free pills in a day, that's not a problem. But other than this, I always suggest, that there are several drinks which are hydrating, which are refreshing, which can be enjoyed by people living with diabetes, which do not have a large amount of sugar. And I would say the topmost in that really is coconut water, which is excellent. So really chilled coconut water, it's refreshing. It has a wonderful high potassium level, it helps with keeping you energized. And most of all, the potassium helps with vasodilatation. So people with high blood pressure, it'll bring down your blood pressure. And it gives you energy. People with muscle cramps, people who get dehydrated in the summers, it's an ideal drink, where not only will it refresh you, it'll hydrate you, but it'll also give you good potassium.
So we can have cold beverages, but in moderation. And secondly, an alternative would be a coconut water drink.
Coconut water, buttermilk, those are top of the list, So they are both excellent, they're healthy, they're hydrating and refreshing drinks, which can be enjoyed by diabetics.
Awesome. But what do you have to say about fruits? Because most of the fruits which people love, they come in summer season. I think mango, watermelon, muskmelon, everything, every fruit which people love, it's in this May, June, July season.
You're absolutely right. So the summers is when you can really enjoy this wide variety of fruits. And even people living with diabetes can enjoy them. There's really no reason for them to restrict their diet in terms of what fruit they can eat. They can pretty much eat everything. What I would suggest is that they really restrict the portion size of the fruit. So they can have every fruit that they enjoy, but they should be mindful of which are the fruits which are going to spike their blood sugars, and therefore cut back on the amount of that fruit that they're having. For instance, instead of having an entire mango, I would always ask my patients who are living with diabetes to restrict, their intake of mangoes to maybe 3 slices or half a mango
Per day?
in one, yes, per day. Similarly, if they want to have watermelon, there is a belief that since watermelon is 90% water, they can have unlimited amounts of watermelon, which is not correct, because having large amounts of watermelon will spike their blood sugars. So I always ask my patients to, restrict their watermelon intake to about 100 grams or half a cup of watermelon, and really have it chilled so that, it satiates that,
Desire
to have
more.
watermelon, and they can enjoy it as much as anybody else.
So, any top 3 fruits which you recommend, and top 3 fruits which you ask your patients to absolutely avoid during summers if they have diabetes?
No, I'm going to answer the second question first. There's absolutely nothing that we ask them to absolutely avoid.
So that they don't feel that we're not living a normal life. Is that
They are living a normal life. And as I said, they can eat everything that they enjoy, but they should just be mindful about how much of that fruit they can have in one sitting. So far as top 3, recommendations, I really don't have a recommendation, because everybody enjoys different fruits. And really, they're free to pick up whichever fruit they enjoy. But I find that, apple is a fruit that is healthy.
apple a day keeps doctor away?
Yes, so it is a good, healthy fruit. It's a fruit that does not spike your blood sugars too much. And it's actually a fruit which uses up more calories in digesting the fruit than you actually, the body gets from eating the fruit. So that's a fruit that really takes care of its own blood sugar.
So, apple on top priority.
Well, if you enjoy an apple, sure.
Cool. But there's one myth also that the fruits which are very sweet, we should absolutely avoid them in diabetes, just like mangoes. But you're saying you can still have them. So what's the reason? Why do people say that it's very sweet, avoid it absolutely?
Obviously, for obvious reasons, it tastes very sweet, and so therefore it must have a very high sugar content. And so people want to, avoid having the fruit so that their blood sugars remain in control. But as I said, even fruits which are very sweet can still be had in small quantities. So there's no reason for you to completely not eat that fruit, but at the same time, you should not overindulge either.
So if you have diabetes and you're watching this video, you can have mangoes, but consult your doctor once
Absolutely.
on how much to have it. Cool. So a similar question arises when we talk about monsoon also, right? So there are so many waterborne diseases that come out during the monsoon season. So how do people with diabetes cope up with them? What are the complications of the monsoon season on people with diabetes?
Right. You rightly said that waterborne infections become more common during the monsoons. And also, not just that your water is likely to be contaminated, but also, food spoilage is more common. So eating out is always risky business, because, you don't know whether it was cooked, what was the water that was used in cooking it, how long has it been out in the heat, and, hot and humid condition. This is the condition that bacteria love. And they tend to multiply very quickly, and therefore infections become much more common during
This season.
During this season, exactly. So, so what I would say is, one, avoid eating out as far as possible. As far as possible, try and eat at home, where not only are you certain about the nutritious value of your food, but also about how it's prepared and how it's stored, and therefore no infections. Secondly, if you're eating out, also try and avoid having raw or uncooked foods where you're most likely to catch an infection quickly. So salads, because you're not really sure if they've been washed thoroughly or not. Fruits that are pre-cut, you're not sure if they've been washed, you're not sure how it's stored. So raw, uncooked foods you should avoid. If you're drinking water, ideally carry your water bottle where you're sure of the water, of the cleanliness of the water that you're carrying. But for some reason, if you're very thirsty and you have to drink outside, I mean, it's always better to not have open water, because then you're not really certain and you can pick up
So
infections from that water.
water is then one thing which you should be very
You should be very, very
Careful
careful
of.
about. In fact, even at home, I would say that you should pre-boil your water, cool it, and then use it. Because you're not even certain that the tap water or even the filtered water that you're using, is it completely infection-free? One cannot be certain. So it's best to boil the water, cool it, and carry that water with you in a water bottle.
In fact, even in monsoon, this dengue and malaria is also very, very common. In fact, non-diabetes people also, but people with diabetes, do they take any special precautions? Any suggestions for people watching this video?
Absolutely. So you're absolutely correct. Dengue, of course, is a dreaded illness which we see every monsoons, and it
Every
plays over
time.
and over again since 1996, when we really had the first outbreak of dengue in Delhi. But yes, during the monsoons, it's very important that we don't allow water to stagnate in and around our surroundings, specifically because the Aedes mosquito, which actually carries the virus which causes dengue, tends to proliferate or tends to multiply in clean water. So it doesn't even have to be dirty water. If you have water stagnating anywhere in your surroundings, the Aedes mosquito is going to multiply in that water. So we should be really careful about not allowing water to stagnate anywhere in and around our surroundings. But apart from that, to wear full sleeves and wear clothing which covers us completely so that we're not open to mosquito bites, because it's not completely possible to avoid mosquitoes as well. Use a mosquito repellent, use mosquito nets. As far as possible, avoid mosquito bites as much as you can. And that's really the only way to protect yourself against dengue and malaria.
So do you see patients coming in during monsoon and telling that I have mad infection due to malaria or dengue?
Typically, they'll come in with high-grade fever. They'll not tell you they have dengue or malaria. But yes, it's very, very important for them to take these precautions, because with the necessary precautions, you can absolutely avoid diseases like dengue and malaria.
And during monsoon, the weather is all too humid.
It's correct.
The temperature is somewhere around 30-35, but you feel like it's 45-50.
Yeah, absolutely. And that's the thing about humidity.
So does that also have a bad impact on blood sugar levels?
So basically, let me just explain what humidity does. Now, normally when you have dry heat, even if it's, 45 or 46 degrees, basically our body is sweating. And we have this mechanism for cooling our body, wherein when you sweat and it evaporates, it cools down the body. When it's really humid, your sweat does not evaporate. So even 35 degree feels like 45 degrees. And that's why it's muggy and it makes you very, very uncomfortable. And the fact of the matter is, when you're really, really uncomfortable, or if you're feeling very hot, then managing blood sugars tends to become a challenge.
As a doctor, do you also suggest some precautions with respect to blood sugar monitoring? Because that's also done from glucometer, right?
Yes, you're right. So one common, problem that we see during the monsoons is that the humidity tends to, cause the strips to malfunction. And so the strips, when they are not working properly, or because they become spoiled because of the humidity, you can get incorrect blood sugar readings. And so that can lead to some panic. You may get very low readings or you may get very high readings. And so it's important to keep those strips very, very carefully, and to ensure that they are not exposed to the excess humidity that you'll see during monsoons. But apart from this, a lot of patients tend to open their pills and keep them in the pill box, according to days of the week. And sometimes, just keeping those pills in the pill box, and when those are exposed to humidity, they may also lose efficacy. So that's another thing that can impact your blood sugar levels. So it's important to be, careful about these simple things that you can avoid during the monsoons. And one last thing I would like to say is, monsoons also come along with, very interminable traffic jams and long traffic. And you may see a situation where you're delayed coming back from work, or you're caught in one of these, traffic jams. So please always keep adequate, both food as well as medicine. So if you're getting extremely delayed and you need to take a medicine, say half an hour before dinner, then make sure you're carrying the medicine with you so that you can, take it just before you reach your home. You can also carry, glucose bars or glucose tablets. So in case, food is delayed because of the traffic jams and you feel that your sugar is dipping, then you have something with you that you're carrying, which can help bring back the sugars up. So simple things like that, just a little bit of planning, and you can enjoy the monsoons just like everybody. Who doesn't love showers in the heat?
Absolutely. So all in all, what I and the audience has understood is that we have to take a few little extra precautions during summers and specifically monsoons. And I think that's all, so that the blood sugars don't rise, so that everything else is also in control. And even the waterborne diseases that are so common during the monsoon season, I think more than the Mumbai traffic in monsoon. So I'm sure if you wanted to know about how seasons are impacting people with diabetes, you've got all your answers, because summers and monsoons are in flow. And if there's any other question you want to ask an expert diabetes doctor, you can let us know in the comments below and I'll make sure it's answered. And if you want to know anything else about diabetes, make sure you follow Vito's YouTube channel.